Hello, hello. Happy Monday. Thank you guys for joining me on Learn with Flo. Running just a few minutes behind from a busy morning of client sessions, so I appreciate your guys' patience. If you guys have been eagerly awaiting our conversations around endometriosis and fibroids today, we're going to continue our journey through Women's History Month. And I really wanted to provide a platform where we get to talk about and really spotlight some of these female hormonal imbalances, especially since I feel like there's just not enough opportunity given to provide this space with some open dialogue and open conversations, especially outside of traditional medicine's understanding of these conditions or kind of lack of understanding of these conditions. And so women are very, very often in my particular practice, I see them after they have seen their gynecologist, or they've seen their endocrinologist, or they've seen their primary care practitioner, or they've worked with people that have told them time and time again that their symptoms are all in their head, or it's a normal part of aging, or, accepting this perimenopause type transition, or debilitating menstrual cycle symptoms. And I'm just a big advocate and a believer that that doesn't have to be our accepted way of life. We don't have to accept that being a woman comes with having daily symptoms that are impacting our quality of life and really keep us from showing up as our fullest selves. So I think it deserves a time and a place to have some conversations around it. So I think this Learn with Flo series and really embracing March as Women's History Month is a great opportunity and stage to do that. So hopefully you've been enjoying the series so far. We're going to continue on today as we get more and more in depth with some of these women's hormonal symptoms and women's hormonal syndromes as well too. So we will talk about things like endometriosis and fibroids today because it gets into more of a full body picture. Now we're starting to think outside of just the influence of the sex hormones, but now we're really starting to think about whole body inflammatory approach and getting into the gut and all of that fun stuff. So if you have been following along with our series, we've covered things like PCOS, we've covered PMS and PMDD, we covered conversations around menstrual migraines, and really starting to talk about and bring to the forefront this conversation of our progesterone to estrogen ratio as women is a very sacred and delicate ratio. At every point of our menstrual cycle, yes, women operate more off of a 28-day infradian rhythm cycle that does in more of your Ayurvedic medicines, it lines up to the moon or the lunar cycle, whereas guys are more aligned to a 24-hour circadian rhythm that lines up with the sun, right? So we've gotten to set all of these different stages and really talk about the fact that throughout the month, different weeks, different days of our menstrual cycle, we're going to have a slightly different progesterone to estrogen ratio. And maintaining the balance of this progesterone to estrogen ratio is really where a lot of the syndromes and the symptoms come from, is when this ratio gets knocked out of balance. So this ratio can get knocked out of balance kind of three different scenarios. One is low progesterone. And that could be coming from, like we talked about in our PCOS type series, of lack of ovulation, or anovulatory cycles can cause low progesterone, or we could still be ovulating but just not creating a very robust progesterone surge when we do ovulate. So we could see this ratio get off because of low progesterone. We could see this ratio become off because of poorly metabolized or stabilized estrogen as well too. So maybe we're creating enough progesterone, but we have too much estrogen still looming in the system. And now that estrogen to progesterone ratio feels estrogen dominant. And that is something that goes back more towards liver detox pathways and gut pathways, which we'll get into in a second. Or that ratio of progesterone to estrogen could be a little bit of both. Some women aren't stabilizing and metabolizing estrogen very well. Their gut and their liver health kind of sucks, and they're not creating a very robust progesterone surge from ovulation anymore. So it doesn't have to be just one answer cut and dry, which is why working with practitioners that truly understand and know hormones are utilizing these approaches to really look at like what is your particular picture, so that way we can treat accordingly. I thought it was highly ironic because when we talk about working with a practitioner that knows hormones, I had a gal apply to work with me one-on-one over the weekend, and in her application she had said how her gynecologist had referred her to somebody that knows hormones, and her version of knowing hormones was saying that she absolutely needed to go on testosterone replacement and start a weight loss drug. And I'm like, that's not knowing hormones. That sounds like more Band-Aid solutions. Like, where was the, and obviously I wasn't in the office and I don't know the entirety of the story, but like, where was the conversation around hormonal physiology? A practitioner that knows hormones is a practitioner that truly understands what impacts hormones. Why would progesterone ratio be low? Why would we be struggling to metabolize or stabilize estrogen? Why would we be having these symptoms or these clusters of symptoms and syndromes that are just treated with more of a Band-Aid approach, right? So it's one of those, just making sure that you're aligning yourself with practitioners that have your same mindset. If you're in the mindset of like, just give me kind of a quick fix, cover this up, shut this up, pill for every ill type of situation, then yeah, more of a traditional medicines approach or understanding of hormones is probably going to line up for you. If you're more in the road of like, I'm ready to get to a root cause understanding of this, like how does all of the things of my body influence hormones, blood sugar regulation, gut health, nervous system function, circadian rhythm, like how am I going to nip this in the butt for good? That's where you'll probably resonate with a little bit more of like a functional or an integrative type approach. So don't expect to get those types of conversations from a traditional medicine standpoint. They don't have the bandwidth for it. So that's okay. That's where you can seek out and make sure you're aligning yourself accordingly, right? So when we think about really knowing and understanding hormones, and knowing and understanding specifically female hormones, we want to really come to the table and have better options and better conversations for women outside of just traditional medicine's approach to some of these things. So that's where we're going to start to get into today, of really taking these progesterone and estrogen ratio conversations one step further, as I want to start talking about some more total body manifestations of sex hormone imbalances, specifically these conditions that we look at of really growth promoting or abnormal growth in a woman's body around endometriosis and or fibroids. So if you're not familiar, let's give some definition to some of these conditions. What is endometriosis, right? Endometriosis is when we start to see the lining that normally grows inside of the uterus, the lining that is shed every month in a woman's menstrual cycle. We call that the endometrial lining. And in endometriosis type conditions, we start to see where women are growing endometrial lining outside of the uterus. So yes, it's that kind of an oddball scenario where we're starting to see endometrial lining growing on the ovaries, or growing on the fallopian tubes, or growing and adhering itself to the inside of the abdominal wall. So as you can imagine, this then contributes to some pretty severe symptoms. Biggest one being severe pain. So heavy bleeding, heavy cramping around menstrual cycles, even swelling or distension of the abdomen during menstrual cycles. There's something out there that you'll see a lot of women that do struggle with this. They call it endo belly, and it's a very distended look to their abdomen during specific times of their menstrual cycle. And even one of the hallmark symptoms of endometriosis too is GI issues, whether that's especially loose stools, diarrhea, bloating, gas, almost like IBS type symptoms. And that's because ironically 90% of women that are diagnosed with endometriosis also are diagnosed with irritable bowel syndrome. Coincidence? I think not. I think that there's probably a really strong connection here that if you're in that more functional or integrative mindset that you're curious about and you're starting to think about, right? So when we think about this, it's kind of, I know that a woman only really knows her menstrual cycle, so it's hard to know how do we compare like heavy bleeding or like severe cramping. To give you a general rule of thumb, if your menstrual cycle takes you out of life, meaning you can't go to work because of pain management or bleeding management, you can't resume activities of daily living because of pain management or heavy bleeding, that's not normal. It should not take you out of work. It shouldn't take you out of school. It shouldn't take you out of social life. It may, like I said, it's normal to feel slight cramping, discomfort during a menstrual cycle, but if it's something that takes you out of commission and takes you out of life, that's a lot. Also, when we think about heavy bleeding, it's like, what is heavy bleeding? Normal amount of blood loss for a period is anywhere from 50 to 70 milliliters. To put that into a context, it would be the equivalent of about 10 to 12 regular sized tampons over the course of your menstrual cycle. It's like, oh yeah, I fill 10 tampons in a day. It's like, okay, that probably would constitute as heavy bleeding. So those are just some basic parameters that we give to help women kind of put themselves into shoes of like, oh, so I can chirp up about these symptoms. Like this isn't normal to go through 5 or 6 super plus tampons every day and be bleeding through things and super heavy period cramping that takes me out of work for 2 to 3 days out of every month. Might be time to start to think about really digging in and asking some questions, right? Because very frequently, even some endometriosis type symptoms in our menstrual cycling years, when we get into a perimenopause or a menopause state, a lot of times those women that do go on to develop things like uterine fibroids do trace back to having ties of endometriosis in their menstrual cycling years. So it's not uncommon. Of course, fibroids can exist without endometriosis, and endometriosis can exist without it developing into fibroids, but all of that can be something to where it's like, oh, okay, so if we just randomly started to have fibroids in our perimenopausal years, some women look back and they're like, I might not have had normal menstrual cycles my whole life, but I didn't know it. Those are the types of conversations that I want to at least be able to bring to the table, because I feel like there's so many more treatments and strategies and conversations than women have been given. And that's where I want to be able to have those types of options laid out on the table so that every woman can decide for themselves what treatment strategy feels best for them to live their best life, right? So when we think about what does it really take for this endometriosis type of picture to take place, it's really the perfect storm of 3 different conditions. Yes, we're going to see an estrogen dominance picture more often than not. That progesterone to estrogen ratio is off, that estrogen dominance picture. We're also going to see a whole body inflammatory response. So this isn't just a women's sex hormone problem. This is well beyond just the progesterone to estrogen ratio, but we're seeing total body inflammation. And we're also seeing some overburdened detoxification and immune systems. So thinking about the liver and thinking about the gut, right? So when we think about this perfect storm, it's like total body inflammation, liver and gut, and estrogen dominance. That sounds like there's a lot of opportunity there to really dig in from a more functional and integrative perspective of what am I eating, when am I eating, how am I living, stress management, sleep, circadian rhythm, gut health, toxin burden, all of those types of things. It's like, where were those conversations for my endo women? Why does it always just have to be like, oh, here's a birth control, we're just going to shut this estrogen situation off because, I mean, obviously your body just can't control it. It's like, but could it? Could it potentially? Or am I just not giving my body the right resources to be able to do that, right? So it doesn't just have to be birth control, or even the surgical interventions, whether it's let's go in and remove some of these lesions, but then they grow back again. I've seen women in here that have had 5 or more different surgical interventions to try to scrape out some of those endometrial lesions, and then they just grow back. Of course they just grow back because we didn't address the root of, we just removed the lesions, but we didn't ask the questions of like, why are they there? Where are we really going at this from a bigger picture perspective? And then eventually, usually if it gets bad enough, they're like, we'll just take all of your vital organs out, right? And then vital organs, I say sex organs, or our uterus, our ovaries in that sense. And so we just do more of a total or a partial hysterectomy, but then also those women are still left with the gut symptoms. They're like, wait a minute, like it didn't go away. I'm like, no, it didn't go away. You don't just get rid of an endometriosis condition by taking out the uterus. It's like, this is a total body inflammatory condition, and your gut and immune system are likely involved too. So there's a much bigger conversation that I think should be happening here, or at least putting the opportunity on the table to have conversations and say, hey, we're seeing an endometriosis picture. What you're going through every single month, that's not normal. And that doesn't have to be normal, but here's our options. We can go a birth control route. If there is just like a point in your life right now where you're like, I just cannot deal, absolutely, we need to be putting something in there so you can live your life every month. But then it's like, okay, if we go down this birth control route, what do we want to be doing to support the body naturally on the other side? We just addressed the estrogen piece here with the birth control. Did we address the inflammation? Did we address the toxic burden? Did we address the immune system? No. What are some of the things that we can be doing from a lifestyle or nutrition perspective while you're on a birth control to be able to mitigate a total body symptom management here, right? And reversal of some of those symptoms as well too. Or same thing, if we decide that like, no, I've gotten to the point where surgical intervention is absolutely needed, 100%. Like even when it gets to like fibroid status, we're not walking around with a grapefruit fibroid in our uterus and pretending like we're gonna like make it disappear. It's like, no, we need to maybe loop in some surgical interventions here, but then also coming to the table and being like, I don't want that bad boy to regrow. I want to really talk about like, where am I feeling and seeing this estrogen dominance and inflammatory conditions in other parts of my life, right? A lot of women have never even been told that like their fibroids in their gut, they're like, I thought those two were like completely separate. I'm like, yeah, more likely than not, they're not completely separate. They're probably very interconnected here, right? So when I think about where I come in from a more like functional integrative standpoint, where my headspace goes when I hear about things like endometriosis, I want to start thinking about all of the different strategies that we can do, one, to be lowering inflammation. Top dog right there, right? So we need to be thinking about anti-inflammatory diets. One of the biggest things that is inflammatory is blood sugar balance. We need to be thinking about potential food triggers. We need to be thinking about processed foods, micronutrient deficiencies, anything that we can do to improve the body's antioxidant capacity and lowering inflammation from diet and lifestyle. Priority number one, huge opportunity there. Then we can also say like, okay, how can we go back and optimize some of the drainage and detox pathways, right? If we have an estrogen like dominance picture, then the liver's job is to be able to detox that estrogen, and then we should be pooping it out. But if we're not taking a daily bowel movement, then all of that estrogen is actually getting reabsorbed in the estrobolome, which is part of our gut, and then reabsorbed back into circulation. So our body's trying to get rid of the estrogen, but we don't have our major detox pathways working to be able to do that. So we're reabsorbing estrogen just as fast as we're trying to metabolize it. So we're just stuck in that estrogen dominant cycle. we can do a lot through liver detoxification and gut health to really optimize that detox pathway and mitigate some of that estrogen dominance. And then last but not least, really looking at supporting the immune system. Is there any more further gut testing that we need to be doing to address things like dysbiosis or chronic gut infections that could be causing some inflammation? So those would be more, like I said, specific once your foundations are already in place, once we have corrected some of the inflammation and some of the estrogen symptoms, some of that gut stuff kind of clears on its own because we work from a north to south approach. But for some women, it's not enough, and they need to dive in a little bit deeper into some of those more functional testing. It's not where I would start, but it's definitely an avenue that some women do get into and can be a game changer for them to really address something like endometriosis and fibroids from a total body wellness condition. So if that's, like I said, not even if you struggle with endometriosis, if that's been part of your health history or you know somebody who has, I again would just be curious of whether those types of conversations were even brought up in more of a traditional medicine atmosphere, because my guess is probably not. But I feel like those conversations are at least deserved. Women deserve to have a platform to hear that there's another side to this, right? That can actually really helpfully like coexist together with a traditional medicine approach or understanding. I'm not saying that, like I said, birth control and hysterectomy and ablations and fibroid removals and lesion removals, like those are absolutely 100% necessary in many situations. But are we coming then on the other end and really supporting why that situation developed in the first place, preventing that situation from happening again, addressing some of the whole body inflammation, and not just leaving somebody without their sex organs, but with all of the gut issues that are still involved in a very inflammatory process. So hopefully that gives you guys a little bit better total body understanding of that endometriosis condition that can be very common. 1 in 10 women are impacted by it, probably even more than women are chirping up. And just know that there is a whole other side to this conversation and understanding once you recognize that endometriosis is really a combination of whole body inflammation, overburdened detox and immune system, and an estrogen dominance type picture. There needs to be a nutritional and lifestyle and stress management component that goes along with some of the traditional medicine practices that really help these women live better quality of life. So if that's something that you're interested in, if it's been part of your health journey, or if you feel like this would be helpful for someone that you know, please pass it along. Let's spread the word. Let's get women's sex hormones and hormonal imbalances a platform to be able to come to the table and talk about it and get everybody the best, well-informed treatment options, because then you as a woman feel empowered to know what options feel best for you. So you can always head to the link in my bio and check it out there. You can see and access all of my courses on Renew University, as well as apply to work with me one-on-one with some comprehensive labs. So hopefully you guys enjoyed that, and we'll have more conversations next week as we wrap up our Women's History Month when we talk about perimenopause. So get ready for that roller coaster. Enjoy your week.